Hello, and today I'm going to be teaching you brain anatomy. So these pictures I'll be showing you are actually pictures of sheep brain from sheep brain dissections, but they are very similar to the human brain, so that is why we study them. So along with showing you some main anatomical features, I'll also tell you some of the functions as well, because I have an exam on this, so I need to know it really well. So this first photo is a dorsal view, meaning that it is taken on top. This is the top of the sheep brain. So the first thing they point out are the fissures, which are basically just delineating lines in the structure. So this is the medial longitudinal fissure, which divides the brain into right and left hemispheres. Then we have the lateral fissure right here, which divides the brain laterally into front and back. And then the central fissure. So medial longitudinal, lateral, and central. And the central fissure is at the foremost part of the brain here, and it divides the precentral gyrus and the postcentral gyrus. And the postcentral gyrus has to do with somatosensory receptors in the skin, muscles, and joints, whereas the precentral gyrus has to do with motor movements, especially fine motor movements. And then some structures you'll see repeated are the spinal cord and the medulla. And the spinal cord is essentially nerve tracts that can be motor or sensory, and the medulla controls some vital reflexes, breathing, things like that. Okay. So now we're going to go to a lateral view of the sheep brain, meaning it is taken from the side of the brain. And once again, we're going to point out the lateral fissure. This time we see it from the lateral view. Here is the piriform lobe, as well as the rhinal fissure that separates this piriform lobe from the temporal lobe. And both the piriform lobe and temporal lobe have to do with olfactory functions, so the sense of smell. And up here at the front of the brain, we have the olfactory bulb, which is one of the cranial nerves I will talk about. That again has to do with smell. So that is all the functions I'm going to point out there. So now we're going to get to the ventral view, which is the bottom of the sheep brain, and we have a lot of structures here, predominantly 12 cranial nerves. Before I go into the cranial nerves, we'll go kind of on the top part of the diagram. We have the pyramidal tract, which is again nerve tracts that are to do with motor and muscle movement. Then we have the pons, so it goes spinal cord, medulla, and pons. So pons are part of the reticular formation, as mentioned, and they can do with arousal, sleep, attention, as well as housing the nuclei of these cranial nerves. Then we have the cerebral pundicle, which is hard to tell, but it's this little kind of triangle shape here. And that has to do with motor info. So my mantra going to this exam is, when in doubt, say it has to do with motor function. And as well as the nerve tract once again. So the cerebral peduncle. And then we have the mammillary body, which the pituitary goes on top of here. And under that is the mammillary body, which has to do with memory, kind of counterintuitively, as well as the housing the nuclei of the hypothalamus, which I'll discuss. This is that rhinal fissure again, but just from a different view. Then this little circular darkened part here is the infundibulum, which connects the hypothalamus to the pituitary, essentially to transport hormones. And then this is the optic tract. Optic nerve right here, which I'll talk about, is your cranial nerve for vision. And where these tracks cross is called the optic chiasm. So yeah, let's go ahead and get into the cranial nerves, because I went over mammillary body, cerebral peduncle, pons, infundibulum, and optic tract, which is where the axon bundles for the visual information. So I have a acronym I made myself for the 12 cranial nerves, and it starts here: save a horse. This is the same nerve. So save a horse, valley girl, very, fatu. So that is my acronym. Let's remember this, but that first one is the spinal accessory nerve, and it actually runs all to right here. So this is all the spinal accessory nerve, and it has to do with shoulder and neck movement. So that's our save-a. Our horse is the hypoglossal nerve, which has to do with tongue movement. Then again, that's the spinal accessory cord that ran down. Then save a horse, valley girl stands for vagus nerve, which has to do with automatic body processes. Then we have the glossopharyngeal nerve, which has to do with taste and swallowing. Then we have the vestibular cochlear nerve, which has to do with hearing and balance, as you can tell from that cochlear ending. And this is the posterior bundle and the anterior bundle. So now we're at the anterior bundle. And then the facial nerve has to do with facial expressions. The abducens nerve has to do with moving your eyes from left to right. The trigeminal nerve has to do with the eyes, face, and inside the mouth. And then kind of inserted here is the trochlear nerve, which has to do with looking down. So when you look like down your nose, that is the trochlear nerve. And then we have the ocular motor nerve, which has to do with opening your eyes, opening and closing your eyes. And then we have the optic nerve, which is vision, the optic chiasm, where the two cross, and the olfactory bulb, as mentioned, is smell. So yeah, that's probably the most detailed area and functions I will have to know. So now we have a sagittal section of the brain, which is essentially when you cut it in half and open it out. So this is the cingulate gyrus, and it has to do with emotion, pain, and automatic motor movements. It's this like gray area here. Then we have the thalamus in the middle, which has to do with relaying sensory information. And the cerebellum is this structure back here, which has to do with movement and balance. Again, we have the spinal cord, medulla, and pons, as mentioned earlier. And a more complex view of that same view, just with some more structures, includes, okay, so I'll start from the bottom. So this little gap here is the fourth ventricle, and the third ventricle is this gap here, and we'll get a better view of that when I show you the next view. But the ventricles essentially hold cerebral spinal fluid. Then this is the cerebral aqueduct, which connects the third and fourth ventricle. And then we've seen this before from a different view. This is that mammillary body. This is the optic chiasm. This is the septum pellucidum, which is a little divider in the ventricle that you will see at a different view. The corpus callosum essentially just refers to the majority of the structure, and it has to do with communication between neurons. The fornix has to do with the pathway of the limbic system, so to the hypothalamus and the pituitary. The massa intermedia is referring to the thalamus. It connects the lobes of the thalamus. The habenula has to do with mood and motivation. Again, corpus callosum. And then we have the hippocampal formation. So hippocampus is up here, hypothalamus is toward the bottom. Pineal body has to do with the circadian rhythm. It has to do with seasonal depression. And then the superior colliculus has to do with visual, whereas the inferior has to do with auditory function. So now you'll be seeing a series of what are called coronal cuts. So basically slicing the brain in little sections. And this is the front of the brain. And you're going to see some repeating structures. So this is the lateral ventricle I was mentioning before. Again, this kind of white matter or entire structure is the corpus callosum. Then the rhinal fissure, and then the kind of darker side of this structure is called the putamen, and then the more central is called the caudate nucleus. So I will talk more about the structures when we get to the next few cuts. So this is that second cut. We have the optic chiasm now. We still have the lateral ventricle, the caudate nucleus, and the putamen. But if you want to see kind of, they're slightly more defined, I would say. The optic chiasm is still here in this third cut. But now you see the globus pallidus, which is this round white, along with the amygdala, which has to do with emotion, and the third ventricle, and the fornix. I don't know if you remember that from earlier about the limbic system, and the septum and the septum pellucidum dividing the ventricle. So essentially the globus pallidus, the putamen, and the caudate nucleus make up what's called the basal ganglia, which is all for the function of voluntary movement. So in this fourth cut, we see the optic chiasm is no longer present, and this is just the mammillary body. And then instead of putamen, caudate nucleus, all that, the thalamic nucleus, which has to do again with the thalamus and sensory relay. And this structure that came visible now is the hippocampus, which has to do with memory. And the final cut, coronal cut, we have the pineal body is now visible, which, like I said, has to do with circadian rhythm. And we still see the hippocampus. And then here we now see the medial geniculate body and the lateral geniculate body. The medial has to do with auditory, whereas the lateral has to do with vision. And then these little black dots that you can't really see are called substantia nigra, which are dopamine and have to do with the sensory motor system. And you can still slightly see the lateral ventricle. And at the top here is the superior colliculus, as mentioned earlier, having to do with vision as well. Those are the structures of the sheep brain, very similar to our brain. And you learned something in that it was relaxing brain. Bye.